Hello, I'm a gynecologist from Milano, Italy, and I met the first time Cinzia 2 years ago in a dinner, a normal dinner, and after 2 years I've been 3 times in Madagascar, so it's very dangerous girl. I'm joking, of course. I'm very happy to be involved in this project. As you know, I work in prevention, and prevention makes the difference between Western countries and low-resource countries. Cancer, if you look at the map of the world, cervical cancer is found in Africa 10 times more than in other countries. Mortality rates very high. The reason is of the presence of screening. Screening is very complicated in Western countries. It requires a lot of knowledge, cytology that should done and be done many times. It requires pathologists, surgeons to do the little intervention, colposcopy. The aim of screening is to find the cervical cancer precursor, because cervical cancer has a little dot that precedes the developing of cervical cancer. Clearing the little dot on the cervix prevents cancer. This type of approach is not possible to be transferred directly in low-resource countries because there is a need of teaching, education, of expert experience. So at present in low-resource countries, as has been already suggested, there is this possibility to use the visual inspection of the cervix with acetic acid to find the little dot and then to eliminate the dot by cryotherapy. Recently, it has been shown that this approach is affordable, but is not very effective. We have new technology coming, and we know now that cervical cancer is due to a virus, HPV virus. This is a very common virus, but persistency of this infection identify a small portion of the population which is at risk to develop cancer. So our project, our idea is to test the possibility to use this type of screening in a low-resource country using this new technology. The power of this approach lies in the fact that one test in life is enough to reassure the woman which is negative. And generally, 90% of the women at the age of 30 or over are negative to the screening test and can be reassured. So all the efforts can be directed only to 10% of the population. We are trying to set up this project in Fianaranzu. Why in Fianaranzu? Because in Fianaranzu there is already a structure, there is already a hospital that is working on screening. The hospital is a private hospital that has done 2,500 pap smear, cytology smears, one of the largest experience in Africa and the most important in Madagascar. So, based in Fianaranzu, we think we have the possibility to investigate this high technology but affordable option also for low-resource countries. In fact, we think that the technology is helpful even in the low-resource setting and should be not restricted to developed countries with local arrangements that made the project, the strategy sustainable but very effective. Thank you for your attention, and fortunately don't have the slides.